Nephritis and HSP. Henoch-Schönlein purpura is the most common vasculitis in children. So, what is the age group affected? Children. Mild renal involvement. What are we studying? Pediatrics, right? Yeah. HSP affects children. Mild renal involvement is indicated by microscopic hematuria and mild proteinuria, which is common here. Serum IgA levels may be elevated. A renal biopsy shows mesangial proliferation with mesangial IgA deposition. Most of the patients recover without any specific treatment, which means this is kind of like self-limiting disease. However, which is why it is most common. Okay, most common things are all like it's not deadly. Okay, it's like common cold, it's not deadly. HSP is very common. It's common in children. It's not deadly. Even without treatment, it's going to get, recovered. However, long-term observation is necessary to detect insidious renal damage. Rarely a patient may present with nephritic or nephrotic syndrome, hypertension, azotemia, crescentic glomerulonephritis. Therapy with a combination of oral and IV corticosteroids, cyclophosphamide initially, followed by maintenance steroids and azathioprine is recommended. Okay. Same treatment as crescentic glomerulonephritis. Angio for cyclophosphamide corticosteroids. Maintenance with, immunosuppression. Angio ingio steroids and azathioprine is recommended. Long-term outcome depends on the severity of renal manifestations. Okay, that's about HSP. Revision. HSP is the most common vasculitis in children. Mild renal involvement. Okay, what kind of involvement? Mild. What kind of hematuria? Microscopic. What kind of proteinuria? That is also mild. What about the serum IgA? IgA is elevated. Where is IgA is present? It's present at the mesangium. What else happens to the mesangium? Mesangium undergoes proliferation. Okay, so what kind of diseases, what kind of treatment do you have to give? It's not like we have to give any treatment. It's a self-limiting disease. Even without treatment, it is going to get better. But obviously, we have to wait and watch for insidious renal damage. For that, follow up பண்ணிக்கிட்டே இருக்கணும். And then, what kind of treatment do we, give? The treatment is similar to crescentic glomerulonephritis. So, IV or oral cyclophosphamide corticosteroids, along with maintenance with steroids or azathioprine is given. Yep, done. Moving on to IgA nephropathy, immunoglobulin A nephropathy. Predominant deposition of IgA in the glomeruli, chiefly in the mesangium, occasionally in the capillary walls, is characteristic. IgA is deposited where? It's in the glomeruli. In the glomeruli, it's in the mesangium, sometimes in the capillary walls. What's the usual clinical manifestation? It's not mild like HSP. There is gross hematuria. Okay. Following an upper respiratory tract infection, each episode lasts for 2 to 5 days. Okay. An acute nephritic or nephrotic syndrome is rarely the initial manifestation. Renal histology shows mesangial proliferation of varying severity. Patients with hematuria, non-nephrotic proteinuria treated with ACE inhibitors. Therapy with corticosteroids, alkylating agents is indicated in patients with nephrotic range proteinuria and also deranged renal function or those with severe histological changes. Okay, so as a quick recap of IgA nephropathy, IgA nephropathy is very bad. So there is a history of upper respiratory tract infection. After a few days after the infection, the child starts peeing a lot of blood. So there is gross hematuria and it's going to be there for 2 to 5 days. Blood in the pee for 2 to 5 days, which is very bad. So IgA will be present everywhere in the glomerulus. Specifically, it's present in the mesangium, but sometimes capillary walls can also have it. Mesangium, just like the previous diseases, is undergoing proliferation. And then treatment, ACE inhibitors is used in case of hematuria and non-nephrotic proteinuria. If it's nephrotic range proteinuria, we are going to use ACE inhibitors. ACE inhibitors can be used if it's a severe histological type and also if the renal function is deranged. Okay, so that's about IgA nephropathy. We're done with HSP and IgA nephropathy. IgA